to the Addiction Rehab Toronto webinar series. We're very excited today as this is our first webinar, and we can't wait to introduce you all to our amazing team. My name's Alex, I'm the clinical director here. I love working at ART because of our client-centered care and obviously the direct work we can have with our clients. I feel very lucky to work along a team that's very interdisciplinary and comes from a lot of different approaches so that we can really provide the best program and treatment plan for each of our clients. So enough about me. I'm going to move it over to the team here, and I want to give each of these lovely people an opportunity to just describe a little bit why they want to work in the field of addictions and mental health, and also why they enjoy working here at ART. So Lisa, why don't you tell us a little bit about yourself? What do you do here?
Sure. So I'm the charge nurse here at Addiction Rehab Toronto. I'm a registered practical nurse. I enjoy working at Addiction Rehab Toronto because I do enjoy the field of mental health specifically and providing emotional support to our clients. One of my biggest things that I really enjoy here is seeing the progress and the change in the client from their initial day here and when they complete their treatment plan here, just seeing the progress. I also really enjoy working with a very supportive team here and the client-centered approach that we do take.
That's great. Thank you so much. Orit, what's your role here? Why do you like working here?
Hi, so my name is Orit. I'm the intake coordinator as well as a primary counselor here at Addiction Rehab Toronto. I work with the clients from the moment they walk through the door, complete their intakes, look at the person as a whole, which we take onto our clinical meetings on a weekly basis as well. We sit as a team and we work with their clients on their goals, look at them from a spiritual perspective, from a behavioral goal perspective, from a medication goal perspective, and we work with them. And I love how our team is so different. We're all so many different people and come from different roads and different paths, and we all work with the clients on the same goal. We'll all have completely different approaches, which I think the clients are extremely lucky to have us as well.
Yeah, I love when you say that we work with clients, because I think that's an important sort of value we have here at Addiction Rehab Toronto, which means, you know, we're not here to, you know, try and make clients make changes. We really want these changes to come from within and kind of meet them where they're at in terms of their motivation to change. And sometimes that takes a little bit of creativity on our part to see how we can really accommodate those needs or concerns or you know, anything that we can do to help them along the stages of change.
Well, of course, we also see them, we look at their learning styles, we check to see if they're kinesthetic, if they're auditory, if they're visual, and we come from a very trauma-informed perspective as well, and when you assign us with our clients, we take all of that into account. We see the person as a whole, which is amazing.
Yeah, awesome. Really good points. Thanks, Ari. Damien, tell us a little bit about yourself.
So, my name's Damien. I'm really excited to be a primary counselor here. What I like about being a primary counselor is I have the opportunity to not only work in groups, not only, you know, work around the house as we go in and out, but also I get the opportunity to really get to the meat and potatoes of the client on a one-on-one basis. The gift of that is I really get to see them go from almost a hopeless state into some hope, and then grow into, you know, thinking about the future, setting goals, and, you know, becoming their true self, basically. That inspires me to be a better person, and also, you know, just inspires me to want to just do more and more and more. Reconnecting families is a big thing that I really enjoy doing. I think it's a big aspect often when we you know, when the addict is in his or her illness, they can get lost, and when they get lost, you know, sometimes people can go chase them, and, you know, and then sometimes what happens is we can get a few people lost. So, you know, with some of the services we offer here, such as our family program on Thursday, every second Thursday, we, you know, can try to make sure that we don't have everybody getting lost, right? So it really gives us a good opportunity, gives me a good opportunity to get to know not only the clients, but also service the family members and, you know, hopefully bring everybody back together in a healthy way.
And I think too with the families, that's a big priority for us. So Arita, I know you were wanting to mention a little bit more about some other supports we provide the family, if you want to talk a little bit about that. So the family program, which is just specifically for the families, which we've noticed is a very receptive or well-received group, as it seems to be growing every single week. But we also provide some other options for them too, right?
Of course. So within the first few weeks, we get sessions going with the client and with the individual along with their family members, whether there be a partner, the child, the parents, anyone that's connected to this individual. And we work as a team with them because we're all there to support the individual all together. And I love how each primary counselor is able to work with their clients based off of that as well.
Yeah. And I think too, another just last point maybe is, you know, each of you have mentioned this team approach, which I am so proud to hear, because yes, we have assigned counselors and psychotherapists with each client, but I think when we hear team, it means that we're all working with all clients, right? So we never really know. We take any opportunity we can get to connect with a client. I might connect with a client despite not being their primary counselor, or Damien might have a client that really, you know, is comfortable with Lisa and values some of the, you know, approaches that she uses. So I think that that's a really important point to kind of address too, and just bring to the table. So that's pretty much us in a nutshell. We're really looking forward to these webinars and you know, teaching or just bringing awareness to a lot of different topics. We're hoping to delve into some of the things we've talked about today, like families or relationships or goals and stages of change and stuff like that. But we wanted to give you all an opportunity to just meet some of the team today, and we hope that if you had any questions, we were able to answer them. Thanks so much.
A trigger can be anything and it'll look different for each person, which the thought might lead up to a craving as well.
Yeah. And so just so we can make sure it's clear, the trigger is something that is triggering the emotional response of us wanting to use the substance. So if that emotional response is sadness or anxiety or a depressive state or triggering isolation or detachment, or maybe even overly excited, there's, you know, some sort of accomplishment or success that's happened, that's a trigger, which, you know, brings the onset of a craving. And the craving is that want for the substance. I just want to make sure we clarify the two. But the points are really well made, I think, guys. And you know, I think it's important, again, when we talk about our family program and the importance of bringing family and the support system into the treatment plan. Oftentimes, maybe you guys agree or disagree, but I notice that oftentimes the people who are the closest to us can sometimes be our biggest triggers. You know, a mom and son that just, you know, have a not effective way of communicating, you know, and that triggers anger and frustration, and then the son wants to get out of the house and go and use. Or opposite, the mom wants to go and have a bunch of drinks in the basement, right? So it's, again, those triggers, as Arit said, the people, places, and things are a really important step in recovery, and something that I think it's important in any center, whether it's ours or anywhere else, to address for the individual.
Yeah.
Yeah.
Yeah, I think in that situation too, I think it's important to point out that, you know, nobody's at fault in that situation.
Yeah,
like
very true.
that example of like the mother and daughter, like, you know, it's not the mother's fault, or mother and son, sorry. It's not the mother's fault or the son's fault. But I mean, you know, what we do here is we can help them coexist and learn to communicate this and get over these kind of resentments and ill feelings that come along with everything, right?
Like what you said, Arita, so learned behavior and perhaps relearning a behavior. And that's really, I think, an important part here is we can't so much fix the past, right? We really need to focus on those principles of forgiveness and solution-based and, love and, coming together in terms of being supportive to an individual who, as we said, is experiencing some element of pain.
Yeah. And often it triggers even like, distorted thinking, right?
Yeah.
What may be something of my history that would have set me off, but maybe that's not what that really is.
Yeah.
Right? So it's changing some of our thought patterns and the way our perspective on things would be is key, right?
So we talked a lot about what the emotional sort of and behavioral signs of addiction are. We haven't yet though kind of addressed the physical signs of addiction. So maybe we can go around again and name just very quick, specific physical symptoms of addiction and or withdrawal, which I think go hand in hand here. So maybe I'll start, but a big one is shakiness. When someone hasn't had let's say an alcoholic beverage for a certain amount of time, but in order for them to lessen their shakiness and anxiety, they need to have a beverage to help them with that. So that could be, again, a physical dependency or addiction, a physical addiction to the substance. A lot of other symptoms though, so let's maybe name some. Dana?
Dehydration, cold sweats, getting sick quite often, depending on the different, drugs or alcohol, whatever they're using. I mean, there's lots of that stuff. But also I think a big one is not taking care of self, right? I think like in the early stages, kind of.
From a hygiene perspective as well, and like health perspective.
Yep, yeah.
Do you have another one?
I would say even, I guess from a medical standpoint too, RLS, so restless leg syndrome, which goes hand in hand with the shaking as well, but just the chronic physical pain that whether it be during the addiction or the withdrawal part of the addiction as well, and not being able to stand up or feeling the back pain, the knees, the joints are a big one as well.
Okay, thanks, Zoe.
And to add to that, even like lots of nausea, stomach pain, decreased appetite. There's a lot of symptoms, even changes in blood pressure, heart rate.
So would that be an increase in both of them?
It depends, really. Yeah.
So depending on a depressant, right?
It depends on the substance, of course, right?
Perfect.
All that takes into consideration the dosage, how long the client's been using. It's all the symptoms and signs of withdrawal. They're not all the same. It really depends on the substance of abuse.
So kind of what I'm hearing everyone say is a big sign of addiction is withdrawal. If someone's experiencing or at the stage of addiction where they're experiencing withdrawal, and that's the nausea, the increased blood pressure, lack of hygiene, anxiety. I think there's also some cognitive things that happen with memory. Also just being able to, as we've spoken about, just feel good about themselves. We might be having someone who's used to be very optimistic and hopeful about their life, and after some use, that's changed quite significantly. Okay, so before we wrap up, is there anything else that you want to add as signs of addiction that maybe we haven't addressed today, guys? I know we're going to discuss again a lot of these topics a little bit more in the weeks coming, like the detox process and what to expect in terms of, again, the stages of change. But in regards to the signs of addiction, anything that you want to just make sure the audience knows?
I'm gonna just say, isolation, right? Like pushing away loved ones, hiding out in basements, and just kind of not showing up for work, and just isolating, keeping to myself,
And depression.
not sharing anything with anybody because there's something I want to hide.
And Lisa, what were you saying?
And I was just saying, and as well, depression plays into that isolating factor as well.
Yeah. Awesome.
I think it's important to remember that it's going to be different for each person. The signs of addiction are going to be completely different, and whether it be the family, the supports, the individual themselves will be able to start identifying that and seeing where their signs are. And the more you know a person, the more you'll be able to see those signs.
Yeah, and learning the triggers, right?
For sure.
Yeah. Well, that was really all great discussion, guys. We look forward to talking more specifically again in the weeks coming about some important topics. We hope you guys stick with us. We're all really passionate about, again, bringing some awareness to the public. And if you guys do have any specific questions, please contact us and we'd be able to address them. So thanks so much.
Thanks, guys.
Have a great day.